Every Thursday, we highlight stories affecting consumers. Over the past year, Americans reportedly borrowed an estimated $88 billion to pay medical bills. Unbelievable. We've partnered with Kaiser Health News and NPR on their Bill of the Month series, which uncovers shocking medical bills. The latest looks at the cost of a life-saving dialysis treatment for 50-year-old Sovereign Valentine. He calls himself Sov for short. Sov and his wife Jessica say their insurance company, Allegiance, said there were no in-network dialysis clinics in Montana. The company, though, disputes this based on their records.
Sovereign used an out-of-network facility and received a bill for more than $540,000 for 14 weeks of care.
The doctor that I saw said, you will do dialysis or you will die.
Our balance bill now is up to more than $500,000. To me, that's clearly just so wrong. It seems unethical.
It was shocking. It was overwhelming. You know, it can be distressing to get bills, but it was so high that it was like, how could this possibly be?
Well, in a statement, the insurance company Allegiance said, quote, the main issue here seems to be a misunderstanding about the availability and location of in-network dialysis centers in Montana. Allegiance later also made special arrangements for an in-network option in Missoula. The insurance company paid more than $16,000, but the couple still owes the unpaid balance of more than $520,000. The editor-in-chief of Kaiser Health News, Elizabeth Rosenthal, joins us now. Good to see you.
Good to see you.
What I kept thinking about when I read this could happen to anybody. So what should the Valentines have done differently? Because this could happen to somebody else.
Well, Jessica is a trained physician, and she worked the system as she was supposed to. So this is kind of a case of the insurer and the provider not being able to agree on whose fault it is. And it's hostage-taking of poor Sovereign Valentine, right, who's left with this bill. You can, as she did, you look to find a provider in network. Always, that's a first step, and it's really smart. She went to the directory, which was hugely, you know, as we know, many directories are inaccurate, they're confusing, it's hard to find, your loved one is sick. And there was apparently no one in network. She checked with a representative from the insurer to confirm that. And then she even went to the insurance commissioner to say, hey, I looked and there's no one in network. So she did a whole lot of stuff in the setting of a very serious life crisis for her husband. And, you know, when we fall into one of those kind of loopholes or pitfalls, boy, the cost can be $500,000. Wow. And no one seems to kind of feel the human reaction of, hey, you know, she tried really hard, and so we're going to settle this. The insurer and the provider are working now to settle it, but they're still in the thick of a big disagreement. And as you said, you know, she's been offered, well, maybe we'll cut the bill by half. Well, great. That's still $250,000, you know, right? That doesn't seem to work. So,
well, I mean, as you said, they're working on. We have a comment from the Kidney Dialysis Center, which is Fresenius. They said they're working directly, as you said, with the patient to immediately resolve this situation. So what should their next step be? And ultimately, will they have to pay this bill?
I really hope they won't. You know, they hopefully Fresenius, and especially now that there's been press coverage, and we see this over and over again. Once there's press coverage, hey, the bill disappears. But of course, that's not a solution for everyone who.
Well, Elizabeth, how does the bill get that high? That's what I find so mind-boggling.
Well, it's pretty shocking. You know, what we see is Medicare pays for most kidney dialysis in this country. They pay about $235 a session. The Sov was charged $14,000 a session. So the list price is, you know, 50 times higher than the price that Medicare would pay. Most private insurers will negotiate that down to about 4 or 5 times what Medicare would pay.
What's a fair price?
Is that a fair price?
Yeah.
Well, that's the problem.
Yeah.
The sky's the limit. The price of a procedure is whatever the market will bear. And if you're stuck, it will bear a lot. I think one option for anyone who's stuck in this dilemma is to find out what Medicare would pay, say, okay, we'll pay 2 or 3 times that, and we'll work that out.
All right.
That seems fair to all involved. But,
Thank you, Doctor. Thank you. I hope they do work it out.